Okay, hi everyone. This is Dr. Sredevi. I'm a gynecologist. I stay in Coimbatore and I work in SB Medical Center. I'm the medical director there. And I completed my MBBS from Sri Ramchandra Medical College in the year 2003. And after that, I completed my DGU from the same college. And I have completed my diplomate in National Board from the National Board of Examinations, New Delhi in the year 2010. And my special interest would be a high-risk pregnancy and infertility. And I deal with gestational diabetes day in and day out. So every day I used to see a lot of patients who are pregnant and they have diabetes as well. I'm also trained to treat fertility patients. I have finished my diploma in reproductive medicine from Kiel University, Germany. And I'm here today to take your questions and also brief you about gestational diabetes mellitus, which is nothing but high blood sugar during your pregnancy. So hope I'm clear. Yeah, thank you for giving me this opportunity, Baby Chakra, to interact with all the parents today. To go about gestational diabetes, let me start with the incidence of gestational diabetes. So you might have heard about gestational diabetes. Gestational diabetes is very common in India. So it is almost 10 to 15 percentage. The incidence is almost 10 to 15 percentage in pregnant women. That is out of 100 women, almost 10 to 20 women most of the times are positive for gestational diabetes mellitus, and it is very common in the urban area when compared to the rural area. In the rural area, gestational diabetes is around 10%, whereas in the urban area, the gestational diabetes is around 20%. So the incidence is very high. Why are we worried about gestational diabetes mellitus? Because during pregnancy, first let me tell you what is gestational diabetes. Gestational diabetes is nothing but high sugars or sugar intolerance, which is recognized for the first time during your pregnancy. So that is called as gestational diabetes mellitus. So you were not diabetic before, but then you got pregnant, and when you went to a doctor for your checkup, when your sugars were checked, it was high. So that is how we diagnose gestational diabetes mellitus. So usually we check the sugars to at least twice during your pregnancy. So first will be during your first visit. So when you visit the doctor for the first time to confirm your pregnancy, your blood sugars will be checked. Even if the blood sugars are normal, again around 24 to 28 weeks of pregnancy, we'll check your blood sugars once again. You know why we check your blood sugars once again between 24 and 28 weeks? Because that is the time, that is between 24 and 28 weeks, that is the time when most of the women who are pregnant become diabetic. So that is why we check again between 24 and 28 weeks. And we don't just check your random blood sugar. We give a oral glucose challenge test. Like we give 75 grams of glucose to you, and after 2 hours, we check your blood sugar levels. And if your blood sugars are more than 140 after taking the glucose load, then we suspect diabetes and we put you on diet. So that is called as medical nutrition therapy, and we'll put you on diet for another 2 weeks. So after 2 weeks of putting the patient on diet, putting the lady on diet, we recheck your postprandial blood sugars, that is your blood sugar after having food. If still the blood sugar after having food is more than 120, even after 2 weeks of following diet and even exercise also, then you are considered to have gestational diabetes mellitus, and we will start you on oral hypoglycemic drugs, which are oral tablets which are given for the treatment of gestational diabetes, or some people might even need insulin during your pregnancy. So why is it very important that you have to treat your sugars during your pregnancy, and what is the cutoff of sugars during your pregnancy? So the cutoff of sugars during your pregnancy is when you are in the fasting state, your blood sugar should be less than 90. Okay, at least be less than 95 milligram per deciliter. And when you have eaten something after 1.5 hours of eating your breakfast, lunch, or dinner, your blood sugar should be less than 120 milligram per deciliter. So why this is very important? Because gestational diabetes mellitus, when it is not treated, is associated with a lot of problems both for the mother and for the baby. So let us see what happens to the fetal development. So we all know that the organs of the baby forms especially in the first 3 months. So it is almost complete by the fourth month. So all the organ development will be complete by the fourth month of pregnancy. So for this organogenesis to happen, that is for the organs to develop, you need oxygen. But whenever there is high blood sugars in your blood, that is when the mother is having high blood sugars, there will be villus edema, that is edema of the villus, in the sense the forming placenta. The forming placenta will be disturbed because of this high blood sugars, and there will be edema. So the blood flow to the developing fetus will be very less. Since the blood flow is less, the developing fetus will not get enough oxygen for the formation of the organs. So because of this, there will be problem in the organ development. That is, they might have problems in the development of the brain, in the development of the spinal cord of the baby, in the development of the heart of the baby, kidneys, and so many problems can occur in the baby if she was a diabetic even before she was pregnant. So this is actually, this is not gestational diabetes. This is called as pre-gestational diabetic. That is, even before she was pregnant, she was having diabetes. So in these cases, the organ development will become problematic. And those with high sugars in the first trimester of pregnancy are also more prone for miscarriages. Okay, and what happens in the second trimester? In the second trimester and the third trimester is the time when we diagnose what is called as gestational diabetes. See, there are two kinds of, let me clear you this, there are two types of diabetes that happen during pregnancy. One is an already pregnant woman, that is called as pre-gestational diabetic woman is becoming pregnant. The other thing is a woman who is not diabetic previously. Oh my. Can you hear me? Okay, sorry for the interruption. So let me start with the two types of diabetes. So you have pre-gestational diabetes as well as gestational diabetes. So what is pre-gestational diabetes? Already diabetic mother who is on insulin or who is using drugs like metformin is trying to become pregnant. Another condition is a gestational diabetes. Here we diagnose diabetes for the first time during her pregnancy. So first, let me talk about pre-gestational diabetes. Suppose a lady is pregnant and she's planning her pregnancy. The first thing that she has to do is first check her blood sugars and make sure her blood sugars are normal before she plans her pregnancy. Her fasting blood sugar should be less than 90 and her postprandial blood sugar should be less than 120. And it is also better if her HbA1c levels is less than 6. So only then she should conceive. You know why? As I already told you, if the blood sugars are very high during the conceptional period, that is during the first trimester of pregnancy, there are chances that there may be problems in the formation of the baby's organs. So it's always, you should always make sure that your blood sugars are normal before you try to conceive. So once you conceive, then if the HbA1c is normal and your blood sugars are well controlled, then usually there won't be any problem in the organogenesis. So what are the problems that you can face if your blood sugars are not under control? Why do you have to worry so much about your blood sugars during your pregnancy? As I already told you, anomalies, that is the fetal developmental problems can come. Some women may also miscarry, and the rate of infections during pregnancy is very high if your blood sugar is not under control. And also preeclampsia, which is nothing but high blood pressure during your pregnancy. For women with gestational diabetes and those with pre-gestational diabetes, the incidence of high blood pressure during pregnancy is also very high. So for pre-gestational diabetes with uncontrolled blood sugars, the incidence is almost 60%, which is very, very high. So we all know that the blood pressure, high blood pressure during pregnancy is also associated with various problems. The other problems that can happen is there might be polyhydramnios, which is nothing but increased liquor around your baby, and the babies might grow very big because of high blood sugars in the mother. So what happens whenever the blood sugar is high in the maternal blood, in the mother's blood, this high blood sugar will also reflect in the baby's blood. So this will stimulate the pancreas of the baby, fetal pancreas, and this will produce more amount of insulin because it thinks that the sugar levels in the baby is high by itself. So it secretes insulin to control the blood sugars. But actually what happens is insulin acts like a growth hormone. So it increases the number of cells in the body of the baby, so the baby grows very bigger. So you would have heard some mothers delivering 4 kg babies and 4.5 kg babies. So this incidence of high birth weight babies are very common with gestational diabetes, which is not very controlled. Not only that, the blood sugar causes increase in the weight of the baby, but it is also dangerous sometimes for the baby's life. Sometimes if the blood sugar is very high, we have also seen mothers having stillbirths. So all this can be avoided just by taking care of yourself, just by seeing the doctor at regular intervals, by controlling your blood sugars and keeping it under control throughout your pregnancy. You should make sure that your fasting blood sugar is less than 90 and your postprandial blood sugar is less than 120. So this is very important. So there can also be problems during delivery. Like what are the problems that can happen during delivery? Because of big babies, they might end up in cesarean sections, or during normal delivery, it can be a very difficult delivery because of the bigger size of the baby. So there is a condition called as shoulder dystocia, which can happen. And so all these are all the problems with having a very big baby and diabetes during your pregnancy. So this is in short about diabetes. There are a lot of things that we can talk about diabetes, about insulin, about the complications that can occur to the mother during your pregnancy. And even after delivery, she might have, because of the bigger baby, she might have problems in the uterus contracting. So she might have excessive blood loss after delivery. So all these problems can be tackled just by doing your diet, exercise, and taking care of yourself. So how your diet should be. Let me brief about the diet that you should take during your pregnancy when you have diabetes during your pregnancy. So you have to first calculate your caloric intake, the calories that you need. So we calculate the calories you need based on what kind of job you do, what kind of work you do. Suppose you are a sedentary worker, you might need 1,800 calories. Suppose you are having some moderate work, you can take 2200 calories, and if your work is really heavy, then you have to take around 2800 calories. This is for a normal adult. And if you're pregnant, you need 350 calories extra during your pregnancy. So how do we calculate the calories that you have to take? Suppose you are a sedentary worker, you take 1800 calories along with 350 extra calories. So that is what you have to take during your pregnancy. So when you take 1800 plus 350 calories, so that has to be divided into carbohydrates, fat, and protein. So you make sure that you take less amount of carbohydrate during your pregnancy, because taking a lot of carbohydrates is the reason for your blood sugar raising. So you have to take meals as three small meals and three small snacks. That is how you should take. You should not load yourself with carbohydrate at one during one meal. What do I mean by carbohydrate? All that which is converted into glucose inside the body is carbohydrate. For example, your whatever breakfast you take, whatever cereals you take, rice and wheat, all kinds of cereals, all these will be converted into sugar inside your body. So this carbohydrate should be reduced when compared with the your pre-pregnancy state. So try to reduce the amount of carbohydrate you take. Suppose you want to take 2 rotis, you can take 1 roti, and you can take a lot of vegetables and dal along with it. So you have to compensate. Also make sure you take a lot of fiber and vegetables. Suppose you have a plate, you divide the plate into half. So one full half should be full of vegetables, which is fiber rich. 1/4 of the plate should be filled with carbohydrates like roti or rice, and the other 1/4 should be for your protein intake. So you should take a lot of protein also to control your blood sugars. So you can take egg whites, you can take chicken, you can take fish, but make sure you don't take a deep fried item. So try to take steamed ones. So this is how you should take. And you should also manage your meal as 3 major meal and 3 snacks. So suppose you're taking your breakfast at 8 o'clock and you have to take your mid-morning snack at around 11 o'clock. And then again you take your lunch by 1 o'clock. Then again you can take your mid-evening snack around 4 p.m. And by 7 p.m. you should have your dinner. So avoid all kinds of pastries, maida items, those with preservatives, chocolates, puddings, sweets, all those things have to be completely avoided. So by doing your diet in this way, your sugars will most of the time be under control. And you also have to have some moderate activity to bring your sugar into control. So what kind of activity you can do? You can do mild exercises, like you can do at least walking for 30 minutes a day. If you are used to doing resistance training, you can go ahead, but don't go on with a heavy weight. Make it little bit light. Okay, so these are the things that you can do to control your sugar during your pregnancy. And also make sure you check your sugars once every 15 days, even if it is well controlled. Okay, suppose you are a pre-gestational diabetic, that is, you were a diabetic even before the beginning of your pregnancy, then you have to make sure that you are checking your eyes for any retinopathy changes, and also your kidneys for any nephropathy changes, because sometimes there may be problem in the eyes, which is called as retinopathy in long-standing diabetic women, and also there might be problem in the kidney, which is called as nephropathy. So these things have to be checked before getting pregnancy, and make sure they're okay, and your kidney function is okay, your eye vision, everything is okay before getting pregnant, because sometimes retinopathy can worsen during your pregnancy. So all these things you have to take into account before you plan for your pregnancy. Okay, so I think I have given a brief idea about diabetes mellitus during your pregnancy. I think now we can start with your questions. I'm very happy to answer your questions. So put it in the chat box. I'll try to answer as many questions as possible. Okay, the first question here is, what puts me at risk of gestational diabetes? This is a very, very important question. Let me make one thing clear to you. We South Asians are all at a very high risk of diabetes mellitus, because we are the ethnic race with high risk for diabetes during pregnancy. But it is not that everybody is going to get diabetes during pregnancy. If you are obese, if your BMI is more than 25, you are at high risk of having your gestational diabetes. If your father or mother is a diabetic, there is family history of diabetes, again there is a high risk of diabetes in your pregnancy. If your previous baby was a big baby, or if you had diabetes in your previous pregnancy, or if your lifestyle is very bad, like you take a lot of junk food, you don't take enough fiber and vegetables in your diet, then you are at high risk of diabetes during your pregnancy. So you have to optimize your weight, maintain your diet before getting pregnant. That is what we call as preconceptional optimization. So you have to optimize your body weight before becoming pregnant, and also take a very good diet before becoming pregnant. Okay, what can I do to lower my risk? Okay, that is the next question I was trying to answer now. So what can you do? You have to bring your BMI to normal BMI. So what do I mean by BMI? So there is a calculation based on your height and weight. So if your height is so much, you have to have a weight of this much. So with that, we have a calculation where it is height in height by weight in meter square. So this gives a roughly a calculation. So the normal BMI is somewhere between 18.5 and 24.9. You calculate your BMI and see if it is between 18.5 and 24.9 before your pregnancy. I mean before your pregnancy, not during your pregnancy. Before your pregnancy, that means your BMI is normal. So your risk for diabetes is very, very less. Suppose your BMI, that is body mass index, is more than 25, then make sure you reduce your weight to bring your BMI to less than 24.9 before planning your pregnancy. So this will lower your risk of diabetes. The next thing is mindful eating during pregnancy. During pregnancy, always there is a concept of eat for two. So that is a very wrong concept. You should never eat for two. The extra calories that you need during your pregnancy is only 350 kilocalories, nothing more than that. So don't load yourself with food. Be mindful of what you're eating. So when you have a proper balanced diet, your risk for diabetes during your pregnancy is very, very less. So this is how you can lower your risk. But in case you're having family history, then you have to be extra careful about your diet and exercise, and also have a moderate exercise before getting pregnant. Okay, how will you test for gestational diabetes? This is the next question. So, how do you test? As I already told you, the first time when you visit your doctor, she will do a test called as OGTT, which is 75 gram oral glucose tolerance test. Okay, so we give 75 gram of glucose, and then after 2 hours, we check your blood sugar values. So if your blood sugar values after taking 75 gram of glucose, if it is more than 140 milligram per deciliter, then it is called as, then you are said to be suffering from gestational diabetes mellitus. Okay, so this is what is called gestational diabetes mellitus, and that is how we diagnose. And for some patients who are not able to take 75 gram of glucose in the first trimester because of vomiting and things like that, then we do a fasting and postprandial blood sugar. So if the fasting blood sugar is more than 90 and if the postprandial blood sugar is more than 120, postprandial I mean after your meals, 1.5 hours, if your blood sugar is more than 120, or during your fasting state, if your blood sugar is more than 90, then it is taken as gestational diabetes. So that is how we diagnose gestational diabetes mellitus. So if you're diagnosed as gestational diabetes mellitus, initially we'll put you on diet for 2 weeks and exercise, and we will reassess again. How could gestational diabetes affect my baby's health? As I told you already, it can cause problem in organogenesis. But if you are a pre-gestational diabetic only, you can have problems with organogenesis. But if you are developing diabetes in the second trimester of pregnancy, which is around 24-28 weeks, still it can affect your baby's health, because it can make your baby bigger. It can make it macrosomic. There'll be a lot of liquor around your baby, and there'll be problems in delivering the baby. Premature deliveries are also very common when there is gestational diabetes, because of lot of liquor around. Sometimes the membranes might rupture. So premature delivery can happen. Because of premature delivery, the baby might have to stay in the ICU for a long time. The baby might have problems like hyperbilirubinemia, which is jaundice after delivery. And also the baby might have problems like low sugars after delivery, or it can have problems like less in calcium or less in magnesium. So it might have to spend some time during in the NICU. And also delivery might be a problem for some people when the baby is really big. So they might have shoulder dystocia, which is difficult delivery of the shoulders during normal delivery, or they might end up in cesarean section. So these are the problems that can happen to your baby because of high blood sugars. Just a second. I'm not able to see the next question. Okay. So how could gestational diabetes affect your health? Yeah, it definitely affects your health also. As I told you, you might end up in miscarriage or preterm deliveries. And sometimes gestational diabetes can worsen during pregnancy, causing preeclampsia. If your blood sugars are not controlled during your pregnancy, then you'll end up also having high blood pressure during your pregnancy. So this can really affect your health. And also you might end up in cesarean section after delivery. You might have increased bleeding because of delivering a big baby. So these are the problems that can happen to the mother. And if the blood sugars are not at all controlled, you might even end up having kidney problem, renal problem also, especially in those who are diabetic even before their pregnancy. So these are the problems that can happen to the mother as well. So you have to optimize your blood glucose level, maintain your HbA1c less than 6, and if your HbA1c is very high, if it is more than 10, the problems can happen really bad. So you have to maintain your HbA1c less than 6 before trying to get pregnant. And how common is gestational diabetes? As I told you already, gestational diabetes is quite common in India. It is around 10 to 20%. It is more common in the urban area when compared to the rural area because of the lifestyle changes. So stop eating junk food, do some exercise, eat whole grains. Don't try to eat all, instead of eating polished rice, you can go for unpolished ones. Include a lot of whole grains in your diet. So by including a lot of whole grains in your diet, you will not have problems like high blood sugars during your pregnancy. Do you get more ultrasound with gestational diabetes? Yes, of course, you might need more ultrasounds during diabetes because we want to assess the baby's growth. Because sometimes, in spite of blood sugar control, the baby might be growing really big. So we might have to do growth scans more often. The most important scan that you have to do is your NT scan, where even the early anomalies can be diagnosed. This is done in your first trimester of pregnancy, at the end of your first trimester, which is between 12 to 14 weeks. And then you have your 5-month scan. So the 5-month scan, you have to do it around the 5th month of your pregnancy to look for any possible anomalies that could have happened to the baby. Then we do serial growth scans to assess the growth of the baby. So this is how we monitor. So the scans might be little more than for normal pregnancy because we have to assess the growth of the baby. We have to look for the Doppler, how the blood flows to the baby and all that. So we might have to do more scans during your pregnancy when you are diabetic. Okay, I think that is the end of the session. That was the last question, I think. I hope you had some insight about gestational diabetes during pregnancy. I'm happy that I was able to answer all your questions. If you have any more questions, I can answer, otherwise I can log off. So the takeaway message from today's topic is, first of all, lifestyle modification is very, very important for most of the diseases, not only gestational diabetes. Lifestyle modification is very, very important in today's world for each and every problem that a pregnant woman faces. So make sure you exercise well, maintain your BMI properly, and then you have to plan your pregnancy. So if you plan your pregnancy after maintaining a normal BMI, after having a healthy lifestyle, after exercising, I don't think you will suffer from problems like gestational diabetes. So that is the take-home message for the day. Thank you so much. Thank you for joining me in this app. I hope I was able to clear your doubts.